Dealing with disc pain can be rough, with it affecting not just your back, but also sending shooting pain down your legs. And if left unchecked, it can escalate to the point where even simple movements become excruciating. But not any old exercises will do the trick. Research has shown that a specific group of exercises can accelerate recovery, with individuals experiencing nearly an 8 times greater likelihood of rapid relief. So in this video, I'll guide you through proven methods to tackle disc pain without invasive measures. You'll learn the right sequence of actions and how to interpret pain signals to regain control over disc pain. Before we dive into the strategies to manage disc pain, let's establish some essential ground rules that will guide you through these exercises. Number 1, it's okay to experience some low back pain during these exercises. Maximal back extension may feel uncomfortable due to stiffness, but it's not harmful and is essential to maximize the benefit. This discomfort will improve with regular practice. Number 2, there are 4 exercises in this sequence, each progressively more intense. If you find relief with a particular step, there's no need to progress further unless symptoms persist. Only advance to the next exercise if the current one stops providing relief. Number 3, perform each exercise for 10 repetitions with a brief period of relaxation in between reps. Aim for a minimum of 4 sets per day or as needed for symptom relief. Treat these exercises as a non-medication pain management tool. Number 4, monitor your symptoms before, during, and after exercise. Ideally, symptoms should diminish in your legs or migrate towards your back, indicating improvement. Persistent leg symptoms suggest ongoing irritation, so the goal is to shift symptoms closer to your back. And number 5, if an exercise makes the symptoms worse, where symptoms in the legs intensify or go further down your legs, go back to the previous exercise. This indicates you may not be ready for that exercise. Okay, now that we know the rules, let's move on to the first exercise. Prone press-ups on your elbows is where we begin to introduce extension to your low back with the goal of reducing your pain and any symptoms in your legs. Make sure you are performing these exercises on a firm surface so that you can have leverage to push up and maximize the effect of the treatment. Notice also I am looking up and taking a deep breath in and out when at the top of the exercise. This allows greater degrees of extension in your low back to ensure you get results. Now this exercise does not result in maximal spine extension and should really only be performed if you are unable to tolerate the next exercise. Prone press-ups is where we should start to notice a more dramatic effect. If you can tolerate this position, this is where you should start. Like the other exercise, a good strategy is to look up and take a nice deep breath in and deep breath out at the top of the exercise to increase the effect. Hold this position for a couple of seconds and then return to the start. Remember, a tolerable amount of low back pain or soreness is perfectly fine. What we are more focused on is leg symptoms. Again, we are looking for those symptoms in the legs to either reduce in intensity or better yet, climb out of the legs towards the back. If that happens, it's a great sign and means you are making a positive improvement. If you are feeling relief with this exercise, stay here and perform it for 4 times a day or as needed to manage your symptoms. But if you maximize this exercise and stop getting additional relief, it's time to move on to the next step. It's now time to get off the surface. We will be doing effectively the same exercise but now in a standing position. To make sure you're getting extension from your back and not from your hips, it's best to perform this exercise with your hips and thighs against an object that won't move. A kitchen counter or table tend to be a good height for this. Once set up, place your hands on your lower back to brace yourself and then extend backwards. Pause at the top for a moment and then return to the starting position. Remember to keep your eye on the symptoms before, during, and after exercise to determine the effect. If you're at this stage, you should be feeling pretty good by now, and most can stop here until symptoms eventually go away. But sometimes you must take an extra step to fully resolve your pain. For the next exercise in our progression, we must go back to lying down, but now we must lay on something that is elevated such as a bed or a couch. This is because we are going to add a little deviation to the exercise. Lay down with the leg that is affected off the edge of the surface. So if your symptoms are in your right leg, make sure you lay down with your right leg off the edge. Once set up, perform your normal prone press-up exercise. Now you're going to notice that setting up like this will target more of a local area in your low back on the same side as the leg that's hanging off. This helps provide a deeper stretch to the lower back where your symptoms are. And just like in the previous exercises, look up and take a nice deep breath in and deep breath out. Pause and then return to the starting position. Perform these exercises until symptoms are controlled and no longer shooting down the legs. Well, I hope you found this video valuable. If you did, be sure to like, subscribe, and share to help others with similar questions and concerns. And stay tuned for the next episode of Physio Show so you can learn more about your body, how it works, and what it needs to keep moving.